Fade-in shot of Augsburg sign, followed by interview with Allison Fick, a family nurse practitioner.
The reason I decided to go into family nurse practitioner program is because I really wanted to help patients along the entire lifespan. So working with babies through elderly, all ages was really important to me. Augsburg has a great program for that because it's a program that focuses on diversity throughout the lifespan and just working with patients and families throughout their entire lives.
Students listening to a presentation in a classroom, followed by an interview with David Clark, a family nurse practitioner.
Augsburg is the real boots on the ground. They have ties to every local group around here. I was actually very surprised at how many links they have. They want to create a balanced partnership, but it really is about getting your feet on the ground and getting to know the people and getting to be a partnership that is interested in growth, not just academics, but like, what do we do to support this community? I think Augsburg sees itself as a resident in the community as opposed to just an isolated university.
Various shots of the Augsburg campus, followed by an interview with Ann Egan, a family nurse practitioner.
My time as far as a student, I spent half time up in Minneapolis and the other half of the time in Rochester. So it was kind of a nice mix. How do you make a small population thrive in a big city? And then we would have some of our classes in Rochester, which is rural Minnesota. It's a different kind of concept there. So it's the difference. I think just recognizes the diversity and the specialty to that, I think, is important.
3 students at Augsburg's Rochester campus sitting and interacting around a table, followed by an interview with Teal Foster, a family nurse practitioner and director of prenatal service.
When I see a patient, I don't just look at them from a diagnosis and then this is what we do.
Teal interacting with a patient in an observation room.
It's not cookie cutter, you don't treat every patient the same way. So take into consideration their individual experience versus just what does evidence-based medicine say you should do.
Interview with Allison Fick, followed by pictures of Hermitage Farm Healing Center, followed by a montage of photos from students' immersions at Sylvan Lake, Custer, South Dakota, and Glastonbury, England.
In order to have a real understanding of what your patients are going through, you have to go directly to the source. So with our clinical experiences at Augsburg and some of our practicum experiences, we travel to other areas. For example, Sylvan Lake. We're getting to learn from shamans who have such valuable and rich experiences that they share with us that make it so important to bring those experiences back with you once you get out on your own as a nurse practitioner.
Interview with David Clark, accompanied by various shots around the Augsburg campus.
I had to acknowledge a lot of biases that I had. I acknowledged stereotypes that I held on to. It's that hard push, that's that jump into the deep end. It's very scary, and then eventually you come out and you say, I have learned something I never thought I would. And Augsburg, I think, is going to bring people there. That's what they do best, is changing your comfort level for sure. But it also pushes you to a place where you're going to acknowledge you know some things, but you have a lot more to learn every day.
Aerial shot of Augsburg campus, followed by a text graphic reading. Augsburg University, Doctor of Nursing Practice, Family Nurse Practitioner track.